Okay, what I wanted to say, first of all, was a lot of people really don't know what nurses do. They think they know, but they don't really know what goes into nursing. And I put up here, nursing is caring, and that is absolutely true. You'll see that's in the definition of nursing. But it's not just caring, but that part of it is the reason that most people want to take nursing. I want to care for people. That's the reason they want to take nursing, is because they want to care for people. So it's interesting that that is the focus, that's the main thing about nursing. And nursing teaches us a lot about God, because God is caring, isn't he? And it shows us many things about God, but today I'd like to take the definition of nursing from the American Nurses Association and show you from the story of Lazarus a little bit more about how nursing is caring. This story is not perfect to illustrate what I want to show you, but it helps. And so this is what I want to do today. In nursing, there are specific tasks. Whoops, what happened? What did I do? Okay. There are specific tasks. Nursing is integrating the art and science of caring and focusing on the protection, the promotion, and the optimization of health and human functioning. Those are kind of big words, but that's really what it is. We want to prevent illness, injury, facilitate healing, and alleviate suffering. Now that sounds like a nurse, doesn't it? And that's through being present. The nurse is the healthcare worker that is with the patient more than any other healthcare worker, because that's their job, to be with the patients. And you'll see why in a minute, but that is nursing, part of the nursing definition. Jesus is our true example of what this is, isn't he? So what you may not know is that nursing is the diagnosis and treatment of human functioning and advocacy of individuals, groups, communities, and populations, recognizing that we're all in this together. We're all connected. We're all humanity. And that's what nursing is. So the part that you may not have thought about was all of the diagnosis that nurses do. And they used to have a set of nursing diagnoses. If you go into our classrooms, you'll see a book on nursing diagnosis. It's not diagnosis of disease, it's diagnosis of functioning. And now they're kind of changing that a little bit and calling it more situation-focused or problem-focused interventions. So today we're going to go through what we call in nursing the nursing process. The nursing process is basic to nursing, and it includes assessment, diagnosis, outcomes identification, planning, implementation, health promotion and health teaching, and evaluation. And that's what we're going to talk about today. Assessment. Now this should help you because all of you need to do more assessment probably. Assessment's just looking around, noticing things. And I'll tell you, I was very bad and still am not the best at assessing. I just don't notice something. You may be a person that you walk up to somebody and when you walk away, you know exactly the color of the clothes, whether they had a sweater or a jacket, whether they had a skirt or slacks or whatever they had on. I'm not that kind of a person. I just don't notice that. I had to train myself to assess, to look around and notice things, because it just wasn't my talent. And so, but anyway, assessment is collecting information. Now, as a nurse, we know certain things that we need to collect, and that part of the education of nurses is learning what kind of things do you need to notice. I can give you a little example. It's my favorite example. Is I went into the room of a patient who had had surgery an hour and a half or 2 hours before, and he had a catheter bag there, and there was no urine in the catheter bag. And I called the student. I said, "Did you notice there's no urine in this catheter bag?" "Oh, no." "Did you empty it?" "No." So that was an emergency, because if somebody's not producing urine after surgery, either something was blocked or else they're not getting enough fluid. So it's kind of an emergency. But it shows something that nurses have to notice. And so it's gathering information. Did Jesus gather information? Well, in the story of Lazarus, there's not anything that says Jesus noted this and this and this, but he did send a message to Mary and Martha, which means that when the message came that Lazarus was sick, they didn't say, "Come right away." They just said, "He's sick." He sent them a message. So he cared, and he took in the information. What information does that imply that he took in? What do you think he noticed about that maybe why he sent a message? Maybe he thought about what Mary and Martha were thinking about if their brother was really sick, right? He sent them a message because he knew they'd be worried. So he took in that information that they would be worried. He also waited 2 days. The disciples didn't know why. And the Desire of Ages says, in fact, that they thought he was uncaring, especially since he hadn't gone and delivered John the Baptist from the prison. And they thought, why is he doing nothing when his friend is sick? But what did Jesus know about this? What information was he taking in that made him wait 2 days before he went there? If he'd been there, what would have happened? Lazarus wouldn't have died, because he is the life-giving presence, and Satan couldn't have come near if Jesus was in the room with Lazarus. So Jesus waited because he knew that if he was there, Lazarus wouldn't have died. And he actually was glad that he wasn't there. He told the disciples he was glad he wasn't there. So he said, "For your sakes, I was not there." So who else was he thinking about? What did he know about the disciples? They needed this, didn't they? And when Lazarus died, he knew it, so he took in that information. So we know he was noticing what was happening around him, even though it seemed like he didn't. And so from all this information, he made a diagnosis. Now, his diagnosis didn't say you have Lou Gehrig's disease, or you have the flu, or Lazarus has COVID, or whatever. He did not make a medical diagnosis. He determined that there was a lot of lack of faith. His diagnosis was, Everyone needed more faith. Mary needed more faith. Martha needed more faith. The disciples needed more faith. And the Jews needed more faith. So he wanted to do something that would increase their faith. So that was his diagnosis, that they needed more faith. So the next thing is an outcomes identification. What needs to happen to get him to more faith? So Jesus looked at this. This is a hard thing for me, and I may not have this right, and you may not agree with what I put on this. But Jesus, as he looked at this situation, he knew that even though his disciples thought that now, since he was going back to the place that was just trying to kill him, they tried to stone him a few days before. The disciples were afraid that he was going to get stoned and they were going to die. Remember, let us go so we may die with him, right? So they were afraid of that. Was Jesus afraid of that outcome? No. He said, I'm under the guidance of my Father. As long as I do his will, my life is safe. My 12 hours of day are not yet ended. And he said, I'm glad I wasn't there, because I want you to believe. I want you to have more faith. That's what he said. And when he got near Mary and Martha's, he called for them, because he knew that he wanted something to happen with Mary and Martha. He called them away from the mourners. He didn't want to go where all that mourning was taking place. Do you remember when he was at Jairus with his Jairus' little daughter? It was so painful for him to be around the mourners. He said, she's not dead, she's sleeping. Which, was she sleeping in the eyes of Jesus? Yes, he considers death asleep. And so she was sleeping. And same with Lazarus, he was sleeping. So he knew that he wanted to do something special for the disciples, something special for Mary and Martha. He did want to do it for the Pharisees that would come, but not the mourners. Are mourners really sad in those days? Were they really sad? They were pretending, weren't they? They would be hired to mourn. They were pretending that they were having terrible mourning, but that was their job. They were being hired to do that. So he didn't want to be around those mourners. So what were his strategies? What did he plan to bring about this outcome? We know that he said, where have you laid him? He wanted to go to the place. We know that he told Mary and Martha, your brother, or at least Martha, your brother will rise again. He wanted to increase her faith in the power of the resurrection. He also wanted her to know that he was the resurrection and the life. He wanted her mind to go away from just the final resurrection to his power and what he could do for her. This is his planning, part of his planning. Like I said, this isn't perfect, so please don't criticize the way I put this together. But I just tried to use this as much as I could. So now Jesus acted. You know that he acted by saying, let's go. I'm going to go that I may raise Lazarus out of his sleep. So I'm going. And he acted they thought it was too late, but is Jesus ever late? He's, somebody just said this to me recently, and I really liked it. He's seldom early, but he's never late. And that's very often true. He never comes as early as we want an answer, right? But he's never late. And so he wasn't late. He was right on time. And he acted when he got there. He was moved to tears by the human distress around him. Was he sad about Lazarus like they thought? No, he was, because he knew he was going to raise Lazarus from the dead, so he wasn't sad about Lazarus like they said, oh, look how he loved him. Couldn't he have done something if he opened the eyes of the blind? Couldn't he have done something to prevent him from dying? But he knew what he was going to do, didn't he? And then he did it. And I actually had some other things here, but I thought, nope, there's something else nurses do. Nurses coordinate care. They don't do everything themselves. And they involve other people in the process, like physical therapists and occupational therapists and the doctors and the pharmacists. They coordinate care for patients. And Jesus did the same thing. And part of his coordination of care was involving the Father, wasn't it? He wanted them to know that it wasn't just him, because they didn't even like him saying he was the Son of God. And so he wanted them to know that he wasn't just the one raising them. And so he lifted his eyes to heaven and he said, Father, oops, I have a little I there. I thank thee that thou hast heard me, and I knew that thou hearest me always. But because of the people which stand by, I said it, that they may believe that thou hast sent me. Isn't that what he was wanting? That's his diagnosis: lack of faith, lack of belief. So he wanted them to believe. So he involved his Father. He also involved the other people, didn't he? I love this coordination of care one, because it really is a lot of what nurses do. He said, take away the stone. He didn't even take away the stone himself. And so he got them. Mrs. White said that whenever there can be human involvement, God likes us to be involved in what he's doing. So think of yourself as rolling away the stone lots of times when he asks you to do something to help somebody. Maybe you're carrying their groceries, and maybe you're sweeping their, raking their yard. Whatever you're doing, you're taking away the stone. You're helping God in reaching their hearts, aren't you? You're coordinating his work in their life. Or involved in it anyway. And then after he had raised Lazarus, he didn't even go and take off those bandages. He said, loose him and let him go. So he involved them. Another thing that nurses do is health teaching and health promotion. And I think Weimar nurses are better able to do this than almost any other nurses, because we have such good background in health promotion here. And all of the New Start principles, all of the principles of health teaching that we have so much that makes people understand how to live in a better way that enhances their health and makes them better people and happier people and more comfortable people and less pain and less suffering in so many ways. Now, what did Jesus do about health promotion in this story? I love this one, because he did the same thing that he does now. He said, Lazarus, come forth. He raised the dead. Does Jesus have to do that for health promotion now? Do you just teach somebody and expect them to do everything you tell them to do? Can they do it? They can't without creative power in their life. And I think we need to remember that. We need the life giver to give life to the people that we teach. And nurses have to remember this, and I think all of us in TCI that are doing any health teaching, we need to remember this too, because people cannot make changes without divine help. It's just not possible. And so we have a life giver that will say, come forth, walk every day. Don't eat this, eat this. Get your rest. You know, people cannot make those changes without divine help. And so he still raises the dead around us and makes it possible. And we think, oh, well, they're being so good. Well, our problem is we forget that they can't do it without Jesus. And the last step in the nursing process that nurses do is to evaluate. And you wouldn't want them to miss this step, because you want them to go back and say, is what I'm doing working? If I've made a decision about what needs to be implemented, what do I need to do to help people out? And then they go back and say, is it working? Maybe they need to change the plan. Maybe we need to change the plan. And so we would evaluate, make a new plan, and then come back and reevaluate. Now, I don't see any evidence of Jesus evaluating the raising of Lazarus, but we can, can't we? We can say, did it work? Did they increase in their faith? Did his plan, was it effective? Did he do the wrong thing or the right thing? He did the right thing, didn't he? And so we can look at it and we can say, yes, Mary, after this, she was the first one to take the news of the resurrection to the disciples. She was at the cross. She was the first one at the tomb. She stayed close to Jesus, and her faith was increased. The disciples, of course, they ran away when Jesus was taken captive, but did their faith increase through all of this? Yes, of course it did. And they eventually gave their lives to give the message of the gospel to the world. Their faith was increased through all of this, and this was a very important story as far as increasing their faith. So we can look at it and we can say, yes, Jesus did the right thing to increase their faith. And I'm sure there are many stories like this where Jesus shows us how he had a plan and how he implemented his plan and how he coordinated care with the others. But this is just one example, and it gives you, does it give you a little inkling of what nurses do in their care? Because they don't just go in there and take temperatures and blood pressures. They are assessing, they are making plans, and then they are thinking of what they're going to do, what goals do they need to have, and then how do they evaluate them. So we can learn a lot from Jesus about how to make the best plan and how to do things that are helpful and caring to others. Jesus was such an example of caring in this. Mary and Martha, even though they thought he had done the wrong thing, when they saw him and saw his look of compassion, his look of love to them, they knew this was the same Savior that they knew before, that they had trusted. And now they could still have confidence in him, even though their brother had died, and their faith was increased. Amen. Father in heaven, we just thank you for this wonderful example of how you take care of us. Each one of us has our own need, and we thank you that you see our needs. You know what they are, and you know what to do. Help us to come to you in our need, Father, individually. Help us to know that you know what we need to do and how we can help others in their needs. So I pray that through this, you'll help us to think more about how we can cooperate with you in bringing out the things that you want to do in our lives. And we thank you in Jesus' name. Amen.